Should you take H2 blockers daily for acid reflux forever? Imagine taking a medication every day 4 years and wondering if it's safe or if you should keep doing it. That's a common question for people using H2 blockers for acid reflux. H2 blockers are medicines that block histamine H2 receptors in the stomach lining. This reduces acid production, helping to relieving heartburn and reflux symptoms. They are often prescribed for conditions like gastroesophageal reflux disease or ulcers, but they are usually recommended for short-term use or occasional flare-ups. Doctors often suggest using them for about 2 weeks at a time. Long-term daily use of H2 blockers is generally not advised unless a healthcare provider specifically recommends it. One reason is that your body can develop tolerance. This means the medication becomes less effective after a few days or weeks. You might find yourself needing higher doses or stronger medicines. Another concern is how long-term acid suppression affects your stomach. Normally, your stomach needs to be very acidic to digest food and fight bacteria. When you take H2 blockers daily, your stomach may become less acidic. This can lead to problems like indigestion, bacterial infections, or malnutrition. It can also increase the risk of developing certain types of stomach infections or ulcers caused by bacteria. Side effects are another factor. Taking H2 blockers for a long time can cause issues like constipation, diarrhea, headaches, or dizziness. In some cases, especially in older adults or those with kidney problems, they might cause mental confusion or disturbances. Some people worry about dependence. If you stop taking H2 blockers suddenly after long-term use, your stomach might produce more acid than before. This can make symptoms worse when you try to stop the medication. For people with severe or chronic acid reflux, doctors might suggest stronger medicines called proton pump inhibitors. These drugs suppress acid even more effectively but also carry risks if used long-term. That's why medical supervision is important. Experts recommend addressing the root causes of reflux, like obesity or hiatal hernia, through lifestyle changes. Losing weight, avoiding trigger foods, and not eating late at night can help reduce symptoms. Sometimes, surgery might be an option if other treatments don't work. In summary, taking H2 blockers every day forever is not usually recommended. They are best used for short periods or intermittently. If you think you need long-term treatment, talk to your healthcare provider. They can help you weigh the benefits and risks and suggest the best plan for your health. Regular checkups are important to prevent complications from long-term acid suppression.